you describe this as community spread? That's a quick question for the CMO. And I'd asked before about this, and you answered me. But how is the R rate doing? The infection rate how is that going? That's it.
Right. So what we have in St. Thomas is described as a cluster of cases, because we are finding that within the parish we have a cluster where we have a number of the cases are actually related to one case that was found, and we had instituted the community quarantine. And within the community quarantine area, there were several cases that were linked to this case, several contacts, and also other members that were picked up through the surveillance. But then also outside of the quarantine area, this person had several contacts outside of the quarantine area, and so therefore we found that a lot of communities were affected. So, but the cases there is some link between the majority of the cases, and so therefore it is considered a cluster. So we have a large cluster. For us, this is considered to be a large cluster, but in other countries you may have thousands of cases in a cluster. But for us, this is a large cluster that we have in St. Thomas, and we also have a large cluster in Clarendon. Now, we have had our discussions for 2 days discussions we have had with our PAHO regional office in Washington and our PAHO local office, that we have discussed the type of transmission that is occurring in Jamaica, and we have concluded that we still remain as cluster of cases within these areas, and the country is still described on the WHO international report as having clusters of cases. In terms of the R naught, I don't have presently the calculation with me, but as soon as we get that, we will update you.
Thank you very much, CMO. We're going to go to Brittany Clark.
Okay, hello, good evening, everyone. Are you hearing me clearly?
Yes, go ahead, please.
Okay, so given the increase, so good evening again, given the exponential increase in the COVID-19 cases, what recommendations does the ministry have with regards to the hosting of elections and the reopening of schools? And given the circumstances, is the health ministry making considerations to have students and teachers tested ahead of the resumption of school? Thank you.
Right. Well, thank you very much for that, Brittany. Please recall that I had indicated earlier in my presentation that the public health recommendations and reports would be considered by the subcommittee of cabinet dealing with COVID, chaired by the Prime Minister. So I would not want to venture a response on those issues until that deliberation takes place, because it's a decision that's not made at this level. It's a decision that's made ultimately by the cabinet. So I'm going to ask for your patience and allow tomorrow to take place, and then we'll be happy to respond appropriately to those questions. Thank you.
Thank you, Minister. We're going to go to Althea Saunders.
Hi, good evening. I just wanted to know, what is the current capacity for quarantining in government facilities? And will the Ministry of Health, or is the ministry contemplating at this point moving more persons into government quarantine, given that, it's obvious that persons are not observing the quarantine rules? Some persons.
Yes, I'm going to ask the Permanent Secretary to speak to the government capacity for quarantining at this point in time.
Thank you very much, Minister, and thank you for the question. So at this point in time, the government has quarantine facilities in every region, but centrally, we have entered into arrangements with 2 local hotels to provide accommodations for quarantine facilities, with approximately 400 rooms being made available to conduct any sort of exercise that we may deem necessary over the next coming weeks.
I'd like to comment on that, if I will. The issue around quarantining and government facilities has to be placed in a context. When we started on this COVID response journey, it was not difficult to establish publicly funded facilities, whether through collaboration with the private sector or otherwise, to house the limited numbers that we picked up based on the major restrictions at our ports of entry, sea and airports, and the limited sort of spread in country. So we could house persons. In addition to that, the temporary closure of a number of our larger hospitality facilities or hotels made it possible to provide accommodation for a few hundred persons. The suggestion or recommendation that we now move back to that has to be contextualized or balanced with the practicality of that implementation. Because frankly speaking, we would not have the number of beds or buildings or institutions that would be able to accommodate the type of numbers that are coming in and are required to be quarantined for 14 days in the first instance. So, as I said earlier, we have nearly 28,700 plus persons who are in home quarantine. The truth is, we would never have been able to find 28,000 facilities or rooms or beds to house these persons. If that number continues to rise based on the policy position of government to allow for the movement of persons in and out, and of course that could change depending on the risk profile, and we get more positive cases, which frankly speaking we expect to get as the risk profile changes, it becomes also increasingly difficult to house positive cases in institutions or hospitals, and the option of housing some of these positive cases, the ones that are asymptomatic, in a home context is going to have to be more a norm than an exception, because it's just about how you manage the sheer numbers. And frankly speaking, persons who don't require hospitalization because they're asymptomatic, what they really want or should be given is an isolation facility, where a home could be quite suitable once that inspection takes place and they follow the protocols that are aligned to the isolation procedures. So I raise that to say, the strategy has to adjust based on the practical realities of numbers and how you deal with those numbers. Now, within that strategy, there are groups that would be given priority, and that's another important point. So our at-risk communities, the persons with comorbidities, the persons who are older, the older population, they are the ones who we have to prioritize and have been prioritizing and giving them the hospital care or beds, and in some of the other facilities where we have that kind of support that can respond to any complications that they develop. So the fact that you're COVID positive doesn't mean an automatic hospitalization. It requires an assessment. It requires an assessment of your vulnerability or not. And then a decision is taken based on your personal setting and what institutions we have and what is possible. It's an ongoing process that requires constant monitoring, and that's the approach that we have taken and will continue to take.
Thank you very much. I'm going to go to Paul Clark. Paul? You need to unmute your mic, Paul.
Got that. Yeah, good evening, everyone. Right. Minister, two quick questions here. One, are there any plans to, close off St. Thomas, much like we did with St. Thomas, given the spike that we're now seeing? And secondly, could you say if there's any evidence of a link between, for persons who have contracted the disease of this number, who may have been part of any political gathering?
All right, so the issue around closing off is a function, of course, of the cabinet based on recommendations from the public health team. And as I said earlier, discussions will be had tomorrow to further assess where we are and what the risk represents and how to respond. So I'll ask your patience on any decision around that. And I think you meant based on what we did in St. Catherine, not in St. Thomas, just correcting you. And the other issue of political activity and COVID cases, I will defer that to the Chief Medical Officer, since it is in the contact tracing of positive cases that a determination is made in terms of types of activities and so on. And I have not been given any report to suggest that, but let me ask her to comment, because I think she may have some other activities that she thinks may be related to some of the cases we're having now.
Right. So the large number of cases that we are seeing now are coming from tests that were done between the 10th of August and the 17th of August. And those are tests that have been done over the last two days, because we've had a large number of cases yesterday as well. Now, the average incubation period is 14 days. However, what we have been seeing is that or I should not say the average incubation period, the extent of the incubation period goes up to 14 days. But what we have been seeing mostly is an incubation period of in the region 5 to 7 days. So what we are actually seeing are probably resulting from activities that occurred over the holiday period of August 1 to 6. So we know that there were a number of gatherings and parties at that time, and we believe that some of what this is happening now 2 weeks later is as a result of those activities there. So we're always 2 weeks behind whatever event it is that triggered, or the activities that triggered what we're seeing now. So I would think that that period of time contributed to that. And so we have to really exercise caution in terms of gatherings at this time, because there is obviously a high risk of exposure, and eventually we will see cases, and we can ultimately see severe cases that can result in deaths.
Thank you very much, CMO. We're going to go to Damian Mitchell.
Hi. Are you hearing me?
Yes, go ahead, please.
All right. CMO, maybe you can just help me here. I'm not sure whether this was said, but can you indicate the areas of concentration for the 98 cases that the minister announced earlier? That's question one. And two, to the PS, I imagine that the budget you had initially made public for the COVID fight would have been exhausted by now. Can you say what's the new budget that you're working with in respect of the response to COVID? I have two other questions, but I'd appreciate if you're able to answer these first.
All right, so let me just read what I had said earlier, Damian. The cases recorded are in St. Thomas, 5 cases, in Clarendon, 7 cases, in St. James, 4 cases, in St. Catherine, 17 cases, Kingston and St. Andrew, 53 cases, St. Mary, 3 cases, St. Anne, 3, Westmoreland, 2, and Manchester, 4 cases. So that's the spread by parish. I mean, there's a further breakdown by area, which we didn't mention here, but the team has that information and are working with it to determine extent of spread. The other question, I believe, PS, your budget.
So thank you very much. The budget is not yet exhausted. You recall in the supplementary estimate that we received in May of this year, an additional $6 billion was provided to the Ministry of Health and Wellness for our COVID response. Of that amount, we have approximately $3.2 billion that has been expended to date. You would understand that because of the nature of the response that we are undertaking, the bulk of the expenditure occurred front end when we made procurement for the equipment and the retrofitting of infrastructure within hospitals to respond in preparation for the response. So what we are now dealing with are expenses that has to do with the field operations, expenses relating to the additional hours of work, relating to staff that are in the field doing contact tracing, staff within hospitals that are dedicated to the COVID wards, that a special allowance was provided and approved by the Ministry of Finance and the Public Service. And so those expenditures are not as resource intense as the front end expenditure that we did when we procured our ventilators and hospital beds, etc.
We're not hearing you, Damon. Please unmute.
It has now shelved. I'm not muted here.
All right, repeat the question, please.
Are you able to hear me now?
Yes, repeat the question, please.
Are you able to hear me now?
Yes.
Just a follow-up to what Althea was asking. Is it that the health ministry has now shelved the idea of a field hospital or field hospitals? And the final question to Dr. Tufton, can you now say, as a follow-up to a question I asked earlier this week, whether the government has reported to the police Dr. Ryan Simpson for disobeying, allegedly, the Disaster Risk Management Act?
On the first question, the answer to whether or not we are planning for any additional capacity, whether a field hospital or otherwise, the answer is yes. It's a fluid situation, and the planning has components to it, short, medium, and longer term. Given where we are now and what we're seeing, we have to prepare for the possibility of greater demand on the public health system. Thank God we are able now to, even with the numbers, to manage what is happening in terms of hospitalization and treatment. But, so much of this is dependent not just on us, but on the extent to which persons comply with the rules. And, that is going to determine how much more we have to do in terms of building capacity. So the field hospital is on the table still, and in fact there are discussions taking place with a bilateral partner around sourcing this facility. And at the same time, however, the discussions around expanding areas for quarantining or isolation outside of the hospital setting, as I had said earlier, that is ongoing, as the PS had said earlier. And so everything is on the table. What we want to do is to try to do it in a timely manner, but also do it in a way that is efficient in terms of how we spend the resources, because there is an issue of limited resources, and so the priorities have to be given preference. On the other issue of the police and the candidate, as far as I know, based on a public announcement that was made, the candidate has been replaced. So there's a new candidate in that constituency. I can't, as far as I'm almost sure I saw that, but you put me on the spot when you asked me about the secretariat of the political activity, because I'd prefer you direct that question to the general secretary or to the chairman within the party. But I don't know. I really don't. I know the question you're asking. I know I'm not hearing.
I'm sorry, Dr. Tufton.
Yes.
I'm sorry. That's not the question I'm asking at all. The question I'm asking is a follow-up to the one I had asked you earlier this week. At the time, you were not aware
Right.
as to what had happened in respect of Dr. Ryan Simpson.
Right.
I'm asking you now, 3-4 days later, whether you have now made that report, or whether the government or any of its agents have made a report concerning Dr. Simpson and his alleged breach of the Disaster Risk Management Act. And this is consequent on what the Prime Minister had said, that the days of moral suasion are now over.
And as I said last time, and I will say again, the extent to which any individual breaches the Disaster Risk Management Act and the particular orders that are put out periodically, any individual at all would be subject to the penalties that are ascribed under the order or the act. I don't have details of this particular case. I mean, forgive me for perhaps being distracted by other very important issues. Not that this isn't important, but I don't have the details, and I don't want to venture a response if I don't have the details. All right? Thank you.
Thank you very much, Minister. We're going to go to Dashan Hendricks.
Yeah, this Dashan Kirk right here. I want to know, I asked the minister last week about schools. Mm-hmm. Are we still on track? Minister, have decided yet if we're still on track for schools September 7?
Right. So, sorry to sound repetitive, but as I said before, the risk assessment and recommendation as it relates to public health ultimately influences a decision by the cabinet, and the subcommittee meets tomorrow, at which point a discussion will take place. I did venture, however, sufficient to say that the cases that are numbering now 98 today over the last 24 hours and splintered around the country is cause for concern. One cannot help but being concerned about that, because it does have implications for movement, it does have implications for congregating, it does have implications for how we assess the risks around school, around kids playing, interacting, and of course going back home to their families, and whether or not it is safe at this time for them or for their families or those they interact with. But again, the decision will be made at the level of cabinet, and I'm sure the Minister of Education will inform the public in short order as to what the plans are.
Thank you very much, Minister. We're going to go to Jamaica Social.
Okay, are you hearing me now? I see that I'm unmuted.
Yes, go ahead, please.
Okay, I'm Cassius Watson for Jamaica Social. I have two questions. One to the SMO. I've seen reports in the past, say, 2 weeks or so, of Americans who were earlier infected, say, in the early part of the pandemic, say, in around late March or March, April, that some have become reinfected. Are you seeing any reinfections in Jamaica at this time? That's to the SMO. And the question to the minister. Minister, we just had nomination day, and I was a bit blown away by what I'm seeing. There's no social distancing, a lot of crowds, everybody hugging and jumping around, people not wearing masks, and their MPs are there observing all of this. I put it to you, sir, that if the people at the top who are governing this country cannot set the example, how is it that those below are going to follow these protocols that you fight so hard for Jamaicans to follow? Your thoughts on what you've seen, or if you've seen anything, what you've heard, and what does this mean for general elections coming? How can you convince someone like me to actually vote? Thank you.
So, in terms of reinfection, I just want to remind you of our process, in that when we discharge somebody from isolation, we do review them at 14 days later, and we do continue to monitor these persons. We have not had any case in Jamaica where we have thought that there was any kind of reinfection, and the whole question of reinfection is not, there's nothing to substantiate that right now in the case reviews. We have had questions like this before in the press briefs where I have said that you may have cases of persons remaining positive long after they have been infected, because we know that some persons up to 65 days in our own experience have remained with a positive test. However, these persons are not able to transmit the virus at that time, because usually what we find is that we have inactive viral particles that are present that still give a positive test. So you may have persons who have tested and tested later after they have been discharged and have been found to be positive. We would not consider that to be a reinfection. You may also have persons who have remained symptomatic or have had a resurgence of their symptoms, but they have not actually cleared the virus. So there's nothing right now to substantiate that persons can be reinfected, but it is still a fairly new virus. Even 7 to 8 months later, it is still too early to give definitive answers about these matters, because we do have to follow patients over time and to see what the result is of that.
On the other question about election campaigning and your observations, I think there has been an effort on the part of the main political organizations to recognize the protocols around nomination day and campaigning. I can speak personally for myself that as a member of a political organization, that was drilled down in a training session to the candidates. I believe on the other side that seems to have been the case too. We did have joint meetings where we discussed the issues with the political ombudsman and others. So I think there's certainly awareness, and we did, I think, again, make an effort to establish the sanitizers, persons who would distribute the masks, the sanitizers, and to some extent minimize the mobilization so that we would not have as large crowds as would normally be the case. As you know, this part of our democracy is accompanied by significant festivities, and it is a motivator for participation, which is something you don't want to discourage. Having said that, there's no doubt that there were breaches, and it's difficult because culturally it's hard to change that kind of behavior, separate and apart from just shutting down the entire thing. So there were breaches, and I certainly observed it. And even in my own case, it was difficult to control persons from, dancing with each other within that 6 feet distancing and so on. The issue is really how you balance that risk that you are taking with the need, given the extraordinary event of an election, to preserve or maintain or to promote the democratic tradition of participation rather than to promote apathy, which is, to my mind, a big threat to democracy. I hope that what has transpired during nomination day will certainly cause persons to be concerned and to take the precautions, but not be so discouraging that persons do not participate in the political process, given the importance of the decision and given the importance of participation in that process. And that includes you, since you personalized the question. So what we have to do from here on is to continue to remind Jamaicans about the need to respect the protocol. There is a campaign protocol and an election day protocol put out by the political ombudsman and the electoral commission, respectively. And we will have to, from the political standpoint and the leadership standpoint, just keep reminding our followers and those who are critical to the process, as well as our voters, to observe those protocols. And I believe there's an effort to do so, but I also think it's a very difficult task given the tradition of political campaigning and electioneering in Jamaica. So we just have to continue that process.
Thank you very much, Minister. We're going to go to Zara.
Good night, everybody. My question is for the minister. On the point of democracy and also transparency, I wanted to find out if and when the questions for Market Me would be answered by you.
I'm not certain which questions you're referring to, but I'll repeat what I've said in the past. This is a COVID conversation press briefing, and I would encourage us to respect the purpose of the discussions around COVID. We have a big issue here as it relates to COVID. In relation to that specific question, as soon as it is appropriate for me to respond, I will. I believe the Permanent Secretary has dealt with the issue as it is his responsibility so to do up to this point.
Thank you very much. We're going to go to Owen Brown from Roots FM.
All right. Good evening. Yes, I wanted to ask a question. Being that there are, a number of cases in Kingston and St. Andrew. Yesterday, in the press release, we saw where some 13 cases were recorded in Kingston and St. Andrew. A number of communities were named recently. Is the ministry considering quarantining any of those communities in the KSA?
Certainly, we are looking at the different areas. I mean, even from today's results that we have not had enough time to really delve in deeply, but we are seeing the same communities being affected somewhat today as they were before. So we do recognize that there are challenges in those communities, but we also do recognize the challenge of being able to quarantine communities within Kingston and St. Andrew. But we are looking at all options, and as the minister has said, that there will be some discussion tomorrow in terms of the types of restrictions that will be put in place in response to what has been shown to be happening over the last couple of days.
All right. Thank you very much, CMO. Our final question is a follow-up from Emma Lewis. Emma, you there?
Sorry. Yes, actually, I was going to ask about the Kingston St. Andrew communities as well, whether you had any kind of breakdown or whether there are any additional communities that you're concerned about in Kingston St. Andrew, whether it's from a sort of scattering of that list of communities that you gave us the other day. So it's similar to what Owen just asked, actually. Thank you.
The communities that we had publicized were communities that we were seeing a heavier load compared to other communities in Kingston and St. Andrew. But several communities across Kingston and St. Andrew are in fact affected. So it is not confined to those areas, but these areas appear to be more troublesome. And so we have to look particularly at these areas to what kinds of interventions that we are doing. And presently we are working with the central ministry team is working with the Kingston and St. Andrew Health Department to effect measures within the community, including increasing health promotion and education in the community that we've already started with those kinds of measures already.
Can I just say something on that? I think that, in mentioning these communities, it's important to appreciate the balance that has to be struck between the possibility of some discrimination taking place against members of the community, because it does happen, and it's something that we want to guard against. but also the need for the public to have the information and to hopefully use this approach to overcome the complacency that I think is setting in and has set in among segments of the population. But at the same time, I want to give or offer some advice respectfully to all, and that is that at this point in the COVID response, I would advise all Jamaicans to assume that every single person you come in contact with is potentially a carrier of the COVID-19 virus. Every single person, barring none, whether it is a relative, a friend, or just a man on the street or in your community. And what that, I believe, should do, and I think it's important, particularly now, it will encourage us to abide by the protocols that we have established as a country, the masks, the distancing, the sanitizing, the avoiding persons with symptoms, a cough, a sneezing, no matter if they tell you it's your sinuses or some other ailment. If we take that approach, it will hopefully encourage us to live by the protocols that we have established. And it's not an invitation to discriminate, obviously, but it is an encouragement to recognize that you really do not know who the next carrier is. We really don't. And as has been shown in the last 2 or 3 weeks, you'll be surprised who the next carrier is, because the COVID virus is no respecter of persons. And the transmission of the virus can take place in so many ways that you could be an absolutely innocent bystander, minding your own business, going about your daily efforts, a law-abiding citizen, upright, hardworking, diligent, industrious, productive, all the positives you can think of. It only takes placing your finger on an elevator knob that someone who is infected uses, putting it in your face, and you're infected at no fault of yours. And what we're saying is we are at the stage where sufficient spread is detected in sufficient number of communities across the country, where we should assume that everyone we come in contact with is at least a potential carrier of the virus. I think it's safe to say that, and it would be a safe way to operate. And I encourage that advice for consideration by all. The CMO wants to add to that. I hope she's strengthening that position.
Yes, I am, Minister. I just want to share with the public, that we did a brief review in some of the areas that we have under quarantine. And what we have found is that most people have the knowledge. They know about COVID. They know about all the things that they are to do, that they are not to do. However, many persons do not believe that it can affect them. It has not been brought home to persons that I can be affected and that I am a vulnerable person or my family members are vulnerable. So we need to convert the knowledge that we have about this disease. We have been spreading the news for several months now, and almost every single member of the population knows about COVID-19, but just as many persons do not believe that it can affect them. But the numbers that we are seeing are showing that it can affect you. And the fact that we have seen an increase in the number of cases that are local, that we have categorized as a local transmission, not linked to an imported case or an import-related case, suggests that we are coming into contact with persons who have been exposed to the virus who do not know that they have been exposed. We are coming in contact with persons who are infected with the virus, who do not know that they have been infected, who do not recognize that they had come in contact with somebody who was infected and are now transmitting the virus. It is very real. It's very real, and the number of elderly persons that we are now seeing that are coming becoming infected suggests that younger persons are bringing the virus home to these elderly persons. We must exercise more caution because coming out of more cases, we can go into a position where we have more hospitalizations and more deaths. Somebody asked earlier about whether or not we were in community transmission. Community transmission is a classification that is done by WHO. And the fact that we have not reached to the point where we are classified as community transmission is not to say that there is not significant spread within these communities that we have been seeing the large number of cases. And it is not to say that we don't have spread in all the communities right across the country. We are having spread. I mean, we are having bedroom spread, bathroom spread, household spread, yard spread. It is being spread right across the country. So we may not reach to a classification where we are calling ourselves community transmission, but don't get into a complacent state where you think that because we are not classified as such, there is no spread in the country. There is spread, and there's spread enough for everybody to be cautious and to take the necessary precautions.
Thank you very much, CMO. Thank you, Minister. And thank you to all our media colleagues on Zoom. We're going to ask our Minister just to give his closing remarks.
Thank you very much, Stephen. Just for academic purposes, and we remain concerned about our colleagues, and it's not an indication to be complacent, but Trinidad has recorded 81 cases today, Guyana 70 cases, and Aruba 91 cases. Countries that are a lot smaller than we are in terms of population. Again, not to be complacent, but just to contextualize the extent of spread of this virus. Indeed, today worldwide, we have had almost 270,000 cases. So, I raise that point in closing to say that COVID still a keep. COVID is still a global public health threat. It's still affecting populations around the world. It still potentially has the risk profile to cause significant harm and even death. And of course, the other implications are the economic, social, and other disruptions of normal life or normal living. Our position is very clear in public health. Firstly, that we must recognize the realities of COVID, the threats, the risks. Secondly, we must see as part of the new norm our approach to living with COVID. There's no question now about getting rid of COVID. It's about living with COVID. And the protocols are so important that we have to train ourselves to become a lot more compliant and make it a part of the new normal. Thirdly, the challenges around trying to play our part, not just the government, but all of us, is a real issue. Now, we have said that the more we adjust, we're on record, the more we adjust from almost total shutdown, we never shut down totally, but certainly significant restrictions in terms of travel and movement, is the greater the risk would likely be, given that there is significant transmission in people movement. And so say, so done. We're witnessing the increased number of cases with the increased restrictions being removed for persons coming into the country, most of them Jamaicans, but also some non-Jamaicans, businesses or business travelers. We have cases of persons coming in for business on contract who, having been tested, are positive, multiple cases. And of course, internal transmission based or spread based on our own activities once persons come into the country. transmission from incoming to locals, locals transmitting to other locals. That risk was always on the table, and we have tried to put in place the surveillance to deal with that. And I think that is working. The system is working in at least picking up these cases and responding. However, the system is not unlimited. Our capacities are not unlimited. We don't have unlimited numbers of persons, unlimited hospital beds, unlimited institutions. And so there can come a breaking point which none of us desire or wish for. And so it is an issue of how do we manage that risk over time as things become progressively worse, if we think they are becoming progressively worse, and how we pull back if we have to pull back. And that's a decision that obviously the cabinet is prepared to make, the Honorable Prime Minister is prepared to make. But I don't want us to leave here tonight thinking that we should go into full-fledged panic about the situation, because that's not how you manage crisis in the first instance. It's really to assess and to respond appropriately. I think Jamaicans can be safe, can remain safe, can overcome the risk of COVID if we follow the rules of engagement, the protocols. And this is why I say, assume that others are not, and ensure that you do. It's like defensive driving. Assume that the other driver doesn't understand the road code, and you take all the necessary precaution just in case that driver has to confront you in a way that is wayward. And I think if we do that, then all of us will end up playing our part. As I said, everyone counts. The government is committed, the team is committed, and I want to thank them for the work that they have been doing. We will keep the public informed, and if there's a need for us to increase the press briefings, because we think information needs to be more frequently transmitted to the public, then we will do so. We will continue to provide the information and communication to all and the encouragement, and we ask that we all play our part as we seek to overcome the challenges of COVID. Thank you very much for listening, and thank you for complying with the protocols that have been established.
Hello? 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 Yeah, you. Hold on, and a pandemic winner. You're now wearing a mask, you're now washing your hand, and you now keep the required 6 feet distancing from other people. And what could I really cause you? You need to stop it. That no mask, no wash, and no distance something there, nah keep. You know what keep? COVID-19. Yeah. It not gone nowhere. COVID-19, they are same way. So here what you are going to do for all of we. Wear your mask, wash or sanitize your hands pan a regular, and yeah, keep your distance, please. And thanks.